Hello and welcome to the program. My name is Maria Yambo. Our social media handles at Maria Yambo at KBC Channel 1 on Twitter, KBC Channel 1 TV on Facebook. Now, people who are deaf, like everyone else, have the right to access healthcare services that are accessible, inclusive, and respectful of their needs. However, one of the most significant challenges they face in accessing healthcare is the language barrier. Now, many deaf people communicate primarily through sign language, which differs from the spoken language used by healthcare providers. This barrier often leads to a lack of understanding, misdiagnosis, and a subsequent infringement on their privacy, as many need an interpreter. Now, Amina Nkaziri is a lawyer and an advocate for the rights of people with disability, while Eunice Mboya is the programs coordinator, the Kenya Association for the Deaf, and she's also an advocate for the rights of deaf women. She's here to share her experience while accessing healthcare as a deaf person. So welcome to you, Amina and Eunice. Yes, I would probably start with Amina. You know, this is a very special community, if I put it like that. You know, a special community in the sense that, you know, I can say, like you said it before, before we came on air, it's the silent world. Sure. What is it that made you want to work around, you know, the deaf community?
It starts with my origin. I am a child born of a deaf parent, and I've been raised by the deaf community as a whole. So I was able to see the challenges they face. That's my interest.
Okay, now Eunice, you're deaf, you know, but you were not born deaf, you know. So you became deaf later on, you know, at 13 years. How did that impact your life? How did that change things for you? Because here you are communicating with your friends and your family members, and all of a sudden life had to change, and probably you needed to learn sign language to communicate. How did that impact your life?
Yes, as you've said, I was not born deaf. When I became deaf, my world got finished. I thought that way because I was young and I had a lot of vision, whatever I wanted to achieve, and then it happened that I became sick and then I lost my hearing. By that time, I thought my world was finished because around my life, in my village, it was not the same thing that would happen any other child around me. So by that time, I thought I was the only person who had acquired deafness at old age. Yes, I know some were born deaf, yes, around our home, but acquiring it, no, I didn't know that. So this affected me a lot by that time. And I remember I almost developed depression, but with the help and care of my mother, the encouragement, they continued encouraging me and advising me, and the family now loved me, and they felt me that I'm still a member of the family. But the world has not ended. I was in class 8 planning to join Form 1.
Okay.
So things happened and it changed my way of thinking, and then later, after 2 years, my parents looked for a school for the deaf, and I joined the school, Kuja School for the Deaf. After 2 years, I stayed at home. I learned a lot because by that time, there are other deaf people there. They had the same condition, just as me. I felt normal. I have the student in my class were people who were never born deaf, but acquired deafness at various ages.
Okay.
And after interacting, then I learned that then we can say I can learn sign language, but specifically to life, and I joined the deaf community. That is what changed me, and I accepted myself and also learned sign language and stimulate with the deaf community.
Wow, that's quite a story over there. Eunice sharing with us. So, you know, as Eunice was speaking, Amina, listening to her, she had a support system. That is number one. We'll be coming to how important a support system is, but something she mentioned, which is, you know, even affect people with proper hearing, and that is depression. When life changes for you, you can actually develop other health problems. And for her, it was depression. So my question to you is, what are some of the challenges that you're seeing, you know, deaf people, you know, experiencing when they're accessing healthcare?
While accessing healthcare, we have got various challenges they face. As a deaf person, when they get to hospital, the mode of communication, let us take a basic level 4 or 2 hospital, whereby you get in and you are told, from here you go to this point at this point. So even how to direct this deaf person can become a challenge, because there are benches, they could sit down, maybe a number is given, and they call out the numbers when someone is inside a room. That is a first challenge a deaf person might face. And secondly, the other one is maybe when they get now after maybe staying, getting a chance to get to see maybe the assistant nurse at the beginning when they are taking their first take, and maybe it could be like, what's the problem? They might be willing to say their issue, but they are told that you have to actually first of all take your weight, your temperature before you see the doctor. And maybe no one is there to give that direction and guide. So for them, they think like, I'm about to see the doctor, and you're told, go back, wait, now for another queue to the hospital. That is our system in Kenya. So in that duration of waiting, another person might come in. They could be on the queue, but they are jumped because their name was called out and nobody was there to actually tell them, excuse me, you are the next patient in line. And now maybe luckily they get now to see the doctor. The doctor's first instinct is like, what's the issue? Normally that's what they ask, and this person is deaf. They could be like, I'm alone, I can't hear, can I write somewhere? And the doctor could be like, what's wrong with this patient, you know, because maybe it is not indicated this patient is deaf. This is something maybe that should be done to indicate this is a person who uses sign language for a first visit. And now maybe by luck, this person can write. It could be lucky for them, they'll write and say, I'm deaf, I write, and this is my case. And in case this person is not able to write, comes in now another issue, because they might have their signs to show where they're feeling unwell, and the doctor might quickly prescribe something without further diagnosis. And now we have another scenario whereby this deaf person might be accompanied by somebody. It might be an interpreter or not.
Okay. We'll be coming to that, the issue of, you know, a deaf person having an interpreter to, you know, tag along with them when they go to see the doctor. But Eunice, as Amina was speaking, you know, she mentioned the challenges that deaf people go through, you know, in accessing healthcare. Definitely sign language is not one of the things or the languages that, you know, most of our health providers, you know, have. You know, so I don't know whether you were able to relate to some of what she was saying. What did she say?
Yes. I think I also want to give a brief information. If you read a report by ILO, the National Labour Organization, about the status of persons with disability, what do they say? Majority of people with disability are from Africa. And then again, majority of these people live in the villages. What am I trying to say? Many people with disabilities, deaf included, live in the villages. Now, I want to have a perspective of how a deaf person visiting our local hospitals. Serious challenges there. First of all, we find that the doctor is surprised that this person is deaf. It means that the doctor is not expecting a deaf person maybe to visit the hospital, or he does not expect that to have a deaf person in Kenya to access health care. Truly, this is a challenge that many deaf people in Kenya talk of level 4 hospital, Now the country, we have many county hospitals. Still, doctors are there who are surprised that they meet a deaf person. When you enter the hospital, and the deaf person, oh, you've entered. When the doctor himself realizes that you are deaf, the doctor will be surprised. I always ask myself, if a doctor, a learned person who understands the body of a human being, is surprised that I'm deaf, what about others? What will they think of it? It means the area of accessibility is still a serious problem, especially for the deaf people. Many are not aware, maybe the curriculum is truly, if they can cover this area, which talk about deaf people. I'm still wondering, many times you find them very ignorant, or they don't know, they don't have any information about the deaf people coming to visit the hospital. Especially if you come, a deaf person who is pregnant, whoops.
So is there an experience, Eunice, probably that
they feel sorry for you? Deaf, pregnant. It means that it's not right for a deaf person to become pregnant. When you wonder if a doctor can think that way, that a deaf person cannot become pregnant, then you can understand a deaf person. So I agree with Eunice with what Amina is saying. The challenges when the deaf experience, they access health services. It has brought a lot of challenges.
So, I just want to follow up that conversation with you, Eunice. Like you said, the doctors who are supposed to understand the human body are also surprised that, this is a deaf person walking in, and then you also talked about, worst, in quotes, is when a pregnant woman who is deaf walks in. So it becomes like, can I say, double tragedy to some extent, for lack of a better word. Do you have an experience that you can share with us? You went to hospital, and then what happened that did not make you happy?
Yes. I remember when both of us were deaf, I've led a friend with who's a deaf person to the hospital. So when both of us entered there, seeking for services, the first surprise and the concern was both are deaf. Then the second surprise was that a deaf girl who is also pregnant. So the doctor was like, who is the man who is responsible? Which man did this? But remember, the girl was over 18 years. So I was wondering, why was the doctor cursing the man who did this? Both of us have agreed. Huh? So I think a lot of communication need to be open on this area about disabilities. Sexual reproduction health is a big challenge with the deaf, that also other persons with disability. There's a lot of misconception when it comes to a deaf person and health. Some areas people feel deaf should not do, some areas maybe trying to live, knowing that I have the right to everything, but the perspective of the world outside there is different. And also, health workers, they have a different perspective. So many times, we talk about the pregnant women, the challenges that they experience, and women experience when they enter the hospital for monthly clinics. When you go, you explain to you as a woman who's pregnant, how maybe the drugs they were given, how they're going to help you, why you must take the drugs, how to prepare yourself psychologically for what is coming next. But for a deaf person, remember, the two cannot talk. The doctor cannot talk with the expectant mother. So many times they go there, they just given the drugs. 1 times 2, okay, I can decide to take this medicine and then they decide to leave. Because why are you giving them to me? If I'm feeling sick, I'm not feeling sick. So why are you giving me all these drugs? Remember, these drugs are not for me, but for the baby who is growing inside me. But the doctor will never explain this. So he'll carry this, Sometimes they don't take because I don't know why. And then later, the parents or a relative say, you must take this. The question is, why? It's a very vulnerable person with the doctor which never said, because they didn't know how to communicate with the deaf person. It's a serious challenge for deaf women.
So, okay, quite a challenge over there. Eunice, you've actually quite elaborated the challenges, and you know, I mean, even as Eunice was speaking, you can I still feel, I can even feel the stress of somebody who's deaf accessing a health facility, you know, and misdiagnosis. Are these things that you're seeing in your advocacy? A lot of it, because if she cannot understand the medical report, the doctor is not able to, or the healthcare provider is not able to explain, and this is something to do with health. Are we seeing cases of misdiagnosis among?
Yes, there are so many. And actually, as I had mentioned, I deal with women and even children as well who have disabilities. And maybe I can just narrow down to sexual reproductive health, right? Whereby I can give a case scenario of one lady and several actually. I've handled cases whereby they get to want to have family planning maybe, and the doctors are like, why should you have it? My own parent will come. I'm a deaf person, so my parent will come and maybe do permanent fertilization for me, and yet I'm not willing to do it. I was not aware, no one informed me. So by the time I'm getting older, I want to get married, I get to realize a procedure was done to me without my knowledge, and that happened so many times by medical professionals who do that, and they end up infringing the rights of these deaf women. And apart from that, just the way Eunice says, in the area of pregnancy as well, it is really a very big challenge, because at times we get post-traumatic depression among deaf persons, because they don't know the time they should push, when they should do this, so they are just left to do it on their own. By the time they're having this baby, it is so stressful for them to even accept and acknowledge this child because of the stress they've gone through in hospital.
And you know, you're talking about privacy being infringed, decisions being made, and the deaf person does not understand. And so for you, Eunice, I know we were speaking earlier, and you talked of how when you go to hospital, say you've taken your child to, you know, for treatment, and then the doctor realizes you're deaf, you're trying to write, but they do not want to, they're also not like patient enough. How does that make you feel when you feel like you are, somebody else is being called in to interpret something that you feel is supposed to be a private moment with the doctor? How does that make you feel?
Truly, most time we feel disappointed and surprised, because sometimes when you enter the hospital with a relative, someone who is young, when you find that doctor will pay attention to this other person and not me, the sick person, as a human being. So when we come, the two of us, all, or maybe whatever I'm suffering from, they just ask this other relative. Remember, this person may not understand truly the situation we am having. So what I'm trying to say, the possibility of misdiagnosis is there. And again, most of the time we come to, sometimes I can come alone as a deaf person. I want services. And then you find the doctor cannot offer the services. So Miss Eunice can write, but there are variations. Some are born deaf, they never went to school. It means this person cannot write well. So the only way to communicate is just through sign language. The doctor cannot communicate in sign language. Tell me, how is this doctor understanding truly the situation of this deaf person if they cannot understand sign language? It means that it's possible they can be given wrong medication or wrong drugs. So for me, who is able to write, many doctors cannot be patient enough to listen to a deaf person. You're trying to write, they are not interested in writing. They feel like they're consuming a lot of their time. So when you start writing, they cannot explain a lot of things. Okay, I know what I want to write. How sure are they? Maybe I'm giving them the basic experience, but the deep situation I've not yet explained. And also, when you try to explain more, they feel you're too much to them. So many times, they're not ready to take long to communicate to a deaf person. They feel like as a bother. At the end of the day, the possibility of misdiagnosis is there. I can give an example. I remember when my niece, younger, around 9 years, we took the hospital, and I felt the temperature of this child was not okay. So when I tried to explain to the doctor, when we found out the temperature of this child, but the doctor already had given us a medicine for malaria, but I felt it's not right. The temperature was very high for me, so I decided to take the child to a different hospital. So when they checked, it was 39 degrees. This person, I know that this temperature was very high. He was given injection to reduce this. So I wondered, I went to the hospital to see a doctor. Already, I've already given medicine. So what if I decided to take the baby back home? Possible would have died because of misdiagnosis. So the patient was not there to listen to a deaf person's story. So when the child goes with a hearing mother, they can listen. But the doctor says, these are deaf. Maybe I don't understand. So I'm worried. What if you can write and you're suffering this way? Now, the other deaf who cannot write, the best way, if this doctor should understand sign language, it will be easy for them to communicate with the deaf patient. So
Eunice, what you're saying is that there is need for doctors and the healthcare providers definitely to be aware, or at least to be taught sign language, and maybe that is, or at least to understand sign language for that matter, so that they're able to cater well for the deaf people, because they're just human beings just like us. They fall sick. They have to access the different services that are there, and that's where I want to ask you, Amina, what are some of the interventions that you think that need to in brief, some of the interventions that you think, because there are hospitals right now that are now employing deaf nurses. I'm not so sure of doctors, but yes.
To me, goes to education, because when we get to incorporate this as part of our training, as maybe being a medical doctor, any medical profession around, if they get to learn even a basics of the signs, it could be easier for them to tend to a deaf person, and they could recommend, if they want maybe an interpreter to help handle the situation, but at least to have the basis of what they know. And to make it easier even for deaf persons themselves to access these trainings, because if a deaf person becomes a nurse, becomes a doctor, the awareness actually grows and it becomes easier for the situation to be handled.
Okay. We could talk a lot. There's a lot that we could have talked about, but time does not allow us to continue. This is a topic that probably we'll need to pick up another day, because there's still a lot to talk about. We barely just touched the surface, actually. So thank you so much, Eunice Boya, for coming in and sharing your experience, and even your advocacy work and your support for, deaf people, especially women. So I want to thank you very much for coming in. Thank you also, Amina and Kadziri, who is a lawyer and an advocate for persons with disability, for their rights, that is. So thank you back at home also for taking your time and listening to us, and I hope you did get to learn one or two and how we need to support our brothers and sisters who are deaf. They are just like us, who need to access healthcare just like any other. So there are gaps, but those gaps can actually be worked on so that they can actually also access services just like all of us. So thank you so much once again. My name is Marie Yambo. I hope to see you again next week. Interpreted this evening was Lancer Odingo.